My presentation is on probiotic fermented dairy products and their effect on metabolic syndrome. And what makes me interested in this topic is because many of my family members have had criteria to meet metabolic syndrome. And also during my inpatient MNT rotation, I saw a lot of patients that also struggled with metabolic syndrome. So anything that we can do to help them would be good to research. So as you guys all know, probiotics are everywhere. They're frequently advertised in grocery stores, health food stores, in magazines, on TV, you name it. There are many sources, so you could get them in capsules, fortified yogurts such as Activia. You could do kombucha, and now there's many flavors that are enjoyable in that. And then there's kimchi, which is a Korean cuisine side dish of fermented vegetables and some seasonings like garlic and ginger. And then kefir is another one, which is a fermented milk product. And obviously there are many more. And if you want, you can share your favorite way to get probiotics or a source of probiotics that you frequently recommend in the comment section. And don't worry, it won't bother me. I can't see it while I'm in here. And then also for the rest of the presentation, if there is anything that you want to share, you can also feel free to put it in the comments box. So we talk a lot about probiotics, but what actually are they? They are live and non-pathogenic microorganisms, meaning that they are not going to harm us, that have beneficial effects on their host, which would be us, when consumed in appropriate doses. There have been many claims made about probiotics, such as that they reduce serum cholesterol, that they are good for immune health, that they have anti-carcinogenic properties, so anti-cancer. They can improve normal microflora, alleviation of intestinal bowel disease symptoms, production of folate to help with homocysteine metabolism, and improvement of glucose sensitivity even before that diabetes or prediabetes hits. And they can also reduce inflammation. Then the other part of my topic, metabolic syndrome, I want to explain a little bit about that too. It's a combination of metabolic risk factors that increase the risk of cardiovascular disease and type 2 diabetes. So these risk factors are dyslipidemia, elevated blood pressure, elevated plasma glucose, a prothrombic state, pro-inflammatory state, and elevated homocysteine levels. So what causes all of these risk factors for metabolic syndrome? Well, there's no single cause that we can say, yes, this is what does it, but there are possible causes. So abdominal obesity, so that waist circumference, insulin resistance, even before prediabetes, which I mentioned before. Physical inactivity can increase the risk of metabolic syndrome. Aging, so the older we get, the more increased risk we have. A hormonal imbalance, and genetic or ethnic predisposition. So to diagnose metabolic syndrome, we'll need to meet at least 3 of the 5 criteria listed in the chart up here on top. The first is elevated waist circumference, and that varies depending on the race of the person. So down here I have the different races listed and then the different measurements that would meet the criteria. And then the next one in our top chart is elevated triglyceride levels, and then reduced high density lipoproteins. So the HDL, or the good cholesterol that we want higher, becomes reduced in metabolic syndrome. And then elevated blood pressure, and then elevated fasting glucose. And I have all of the measurements listed over here on the side. Usually for metabolic syndrome, if you would go to see a dietitian, they would adjust food choices to promote a reduced energy intake with an ultimate goal of a 7 to 10% weight loss within the first year. They would encourage a cardioprotective diet, increasing whole grains and fiber, and decreasing saturated fats, trans fats, and added sugar. And they may even recommend a specific diet such as the DASH diet or the Mediterranean diet. They would also promote physical activity with a goal of at least 30 minutes per day, 5 days a week, and walking counts. Then they would also encourage continued counseling support to help continue to meet your goals. So why probiotics and metabolic syndrome? Well, metabolic syndrome is a precursor to cardiovascular disease and type 2 diabetes, which are increasing in prevalence. There's predicted to be about 366 million patients with diabetes by the year 2030, which is an important healthcare and socioeconomic issue, as this costs our patients and the government a lot of money to help people with metabolic syndrome. And probiotics such as lactobacillus and bifidobacterium have been proven to have anti-inflammatory effects on the body. So anything that we can do to help these patients prevent the cardiovascular disease and type 2 diabetes would be great. So some lab value terms that my studies used that you may not be as familiar with are the HOMA-IR, or the homeostatic model assessment of insulin resistance. The optimal range and the equation for that is listed. So it's based on serum insulin level and blood glucose level. If the HOMA-IR is high, it indicates insulin resistance, which we don't want. And then the next one we have is Quickie, or the quantitative insulin sensitivity check index. I have the optimal range listed as well in the equation to get that. It has to do with the fasting glucose and the fasting serum insulin levels. If the Quickie is low, that indicates insulin resistance. So we would want the Quickie to be higher for improvement. And then the last one I have down here is homocysteine, which I mentioned briefly before. It's used for protein synthesis, and it's broken down by vitamin B12, B6, and folic acid. So likely if your homocysteine levels are high, you have an inadequate level of vitamin B12, B6, or folic acid, and this indicates a greater risk for heart disease. So the first study that I did is the effects of regular kefir consumption on gut microbiota in patients with metabolic syndrome. It was done in Izmir, Turkey, and published in 2019. The purpose was to investigate the effects of regular kefir consumption on gut microbiota composition and their relationship to components of metabolic syndrome. It was a randomized and controlled clinical trial involving 22 participants that were randomly allocated into two groups, either a kefir group or an unfermented milk group. To be included, they had to be 18 to 65 years old and diagnosed with metabolic syndrome using the criteria that I discussed previously. They were excluded if they had any use of antibiotics in the past month or during the intervention period. If they used any probiotic, prebiotic, or symbiotic supplements during the past 3 months or in the intervention, they were excluded. If they were also excluded if they were pregnant or lactating, had any severe liver, kidney, or immune deficiency, any chronic gastrointestinal symptom diseases such as type 1 diabetes or cancer, if they had a dairy allergy or lactose intolerance, just because dairy was the test drink in the study, and they were also excluded if they took any prescribed drugs that would modify their lipid profile or glycemic control, and if they were non-compliant with the consumption of the test drinks. The time frame of this study was 12 weeks. They screened for the inclusion and exclusion criteria, and then at week 0, they assessed the dietary intake using a 24-hour diet recall. They did anthropometric measurements, baseline blood and fecal samples, and the fecal samples were used to test the gut microbiota at the beginning of the study and at the end to see if the different bacteria in it changed. And then they also gave the participants information about consumption and storage of test drinks. So then at week 1, they started taking the drinks. Then weeks 4 and 8, they assessed compliance. And then at week 12, they assessed dietary intake again and the anthropometrics and final blood and fecal samples again. So this chart highlights the important results. So the serum insulin level improved significantly. As you can see, the p-value is less than 0.05, and this was for P1, which is just comparing the kefir group from baseline to the end. And then also for the kefir group, the HOMA-IR improved significantly with a p-value of 0.05. And then also important, the unfermented milk group did not have any significant results from beginning to end. And then the P3 over here indicates if there would be a significant difference between the kefir group and the unfermented milk group, and none of those differences were significant either. Then it shows some of the inflammation-related indicators. So as you see, the tumor necrosis factor alpha and the interferon gamma improved significantly in the kefir group. And then in the unfermented milk group, the interleukin 6 improved significantly, and none of them improved between groups. And the systolic blood pressure actually improved in both groups, and the diastolic blood pressure just improved in the kefir group. This chart shows the composition of the gut microbiota, so why they took the fecal samples was to get this chart. And the only significant difference that they found was the actinobacteria here in purple increased during the study. So before, you can see in the group there was no purple, and after there was purple, and then in the control group it was very small in the beginning and then it increased at the end. The strengths of this study were that it was a 12-week study, which was long enough for them to see some results. And they did use objective measurements of the data, so lab values and tests that were standard. And the limitation were the small number of participants, only 22. The attrition rate was actually 55%. They started with 40 participants and only 22 finished. In conclusion of this study, the kefir could provide some improvements in glycemic status, inflammation-related indicators, and blood pressure. However, none of the improvements are significant when compared to the unfermented milk consumption. The actinobacteria increased significantly in the kefir group compared to baseline, but the unfermented milk produced a similar change, as we saw in that chart. So overall, kefir may help improve the parameters of metabolic syndrome, but unfermented milk produced a similar result. And I gave this study a neutral rating just because, like I said, there was only a 55% attrition rate. And the serum insulin level at baseline actually was significantly different between the two groups. My next study is the effect of daily fortified yogurt consumption on weight loss in adults with metabolic syndrome, done in Shiraz, Iran in 2018. Its purpose was to determine the effects of daily consumption of a probiotic fortified yogurt on weight loss in overweight and obese patients with metabolic syndrome on a calorie-restricted diet. So it was a randomized controlled clinical trial involving 87 participants, randomly allocated into two groups, either consuming a fortified yogurt or a plain low-fat yogurt. They were included if they were diagnosed with metabolic syndrome, 20 to 65 years old, and had a BMI of 25 to 34.9, so in that overweight to obese class 1 category. And then the exclusion criteria, pregnant or breastfeeding, any antibiotic use, cigarette smoking, and regular alcohol consumption, vitamin, mineral, or omega-3 supplementation, regular consumers of yogurt and probiotic products, a weight loss greater than 10% of body weight within 6 months before the study, and any recent change in physical activity levels. The study design was that the participants were instructed to consume 500 calories less than their calculated energy needs, and this was done by using the Mifflin-St. Jeor equation to calculate everybody's individual needs, and then 500 calories was subtracted from that. Participants consumed fortified or plain yogurt twice daily, so at lunch and at dinner. The fortified yogurt was fortified with whey protein, calcium, vitamin D, prebiotic fiber, and probiotic cultures. The yogurts were the same in calories, And an interesting fact about the study was that a daily reminder was sent to the participants to remind them to consume the yogurt. The participants also had to return the empty yogurt containers to prove that they ate them. And then the anthropometric and biochemical data was taken at baseline, week 5, and week 10 during the study. The results of this study were pretty astounding. As you can see, the p-value A, which represents the difference from baseline to the end in the fortified yogurt group, was that all of them were significant, all this list of different parameters. And then the p-value B indicates the difference between the groups. So between the groups, the waist circumference, fat mass, body fat percent, insulin, HOMA-IR, triglyceride, HDL, and vitamin D levels significantly improved in the probiotic fermented yogurt group. The strengths of this study were the high adherence to consuming the yogurt in both groups with a nutrition rate of 96.7. The composition of the fortified yogurt was very specific, as I showed you in the previous slide. Limitations were the short duration of the study, only 10 weeks. I would be curious to see if this study went on longer, if they would have different results. They also did not look at the differences between males and females. And participants were on calorie-restricted diets. So it's really unknown if the fortified yogurt would have had the same effects in normal circumstances. In conclusion of this study, the composition of the fortified yogurts may reduce fat mass, preserve lean body mass, improve insulin sensitivity, improve triglyceride and HDL cholesterol levels. However, it was only studied in overweight and obese individuals that were on a calorie-restricted diet, so we don't know if in normal BMI or normal calorie consumption without the decrease, if it would have the same results. And overall diet and exercise are still important. I did give this study a positive rating though, just because it was a randomized double-blind study. The intervention and outcomes were clearly defined and they used objective measurements such as their lab values. My last study is the effect of probiotic fermented milk, or kefir, on serum level of insulin and homocysteine in type 2 diabetes patients. The study was done in Tabriz, Iran in 2017. The purpose was to investigate the effect of probiotic fermented milk on serum level of insulin and homocysteine in type 2 diabetes patients. It was a randomized, double-blind, placebo-controlled, and clinical trial. The intervention involved 60 participants that were randomly allocated into 2 groups, either consuming probiotic fermented milk, which is kefir, or a conventional fermented milk, which is sourdough. And it did not say exactly which form of sourdough they ate or drank. The criteria for inclusion of this study was that they had to be diagnosed with type 2 diabetes, so the fasting blood glucose above 125. They had to be 35 to 65 years old, no insulin therapy, and an illness duration, so the diabetes duration, less than 20 years. They were excluded if they were pregnant or breastfeeding, had any conventional medical disorders such as thyroid, gastrointestinal, cardiovascular, kidney, or autoimmune system diseases, if they smoked cigarettes, if they used any steroidal anti-inflammatory drugs, if they used any vitamins or minerals, and if they did hormone replacement therapy. The study design was that the products were consumed twice daily, again at lunch and dinner for 8 weeks. The supply was received weekly, and the probiotic fermented milk kefir contained these different probiotic bacteria that I have listed, and then the conventional fermented milk only contained 2 of the bacteria just from the fermentation process. So the participants were instructed to maintain their usual dietary intake, their usual lifestyle, meaning not modify their exercise or physical activity levels, to continue taking any non-probiotic vitamin and mineral supplements, and any medications that were crucial to maintaining their normal life. And then the anthropometrics and fasting blood glucose were measured at the baseline and the end. The result of this study were that the insulin, as you can see here, improved significantly. The p-value is 0.05, and that the PB indicates the difference between the two groups. So in the probiotic fermented group, the kefir, the insulin serum level improved significantly, and the HOMA-IR improved significantly between groups and within the probiotic group from baseline to the end. And the quickie did not improve significantly in either group. The homocysteine levels improved significantly from baseline to end in the probiotic group and baseline to end in the conventional group, but did not increase or improve between groups. And then I also want to point out that the BMI did not improve significantly in either group or when the groups were compared. The strength of the study was the participant adherence rate, 100% attrition rate, which is very good. It was a clinical trial. They controlled for BMI and the duration of the type 2 diabetes. And the limitations were the short duration of the study. So it was only 8 weeks. So I'd be curious again to see if they had the study go longer, if their results would be different. And they did not track the total energy intake. So they did not have any way of tracking whether the participants were eating more, less, or the same as usual. In conclusion of this study, the fermented milk fortified with certain probiotics can decrease insulin serum levels, decrease the HOMA-IR levels, and decrease serum level of homocysteine. Only the decrease in the HOMA-IR and the serum insulin levels were significant between the two groups, and there was no effect on BMI. And then I gave this study a positive rating because it was double-blind. It had an adequate sample size and 100% attrition rate, and the intervention and outcomes were clearly described. In summary, I made this table to compare the three studies. The asterisk indicates the effect of the probiotic fortified item significantly reduced the metabolic syndrome parameter compared to the conventional fermented item. The pluses indicate that the probiotic fortified item significantly reduced the metabolic syndrome risk factor just within the probiotic group from the baseline to the end. And then the minuses indicate that the probiotic fortified item did not significantly reduce the metabolic syndrome risk factor. So as you can see, there are a lot of pluses on this slide and some asterisks indicating that probiotics are very beneficial. The implications for the profession, I would say, are that probiotic fortified fermented products are beneficial for reducing the risk factors for metabolic syndrome. As you saw in the chart on the previous slide, there were a lot of pluses and asterisks indicating that, yes, this did help the people in the study. The non-probiotic fortified fermented products are also shown to reduce metabolic syndrome factors. As we saw in many of the studies, they had the same results as the probiotic fermented group. The risk factors are interconnected and influenced by the microbiome. So especially in that first study, we saw that introducing these probiotic fortified beverages can modify the microbiome, and it's all interconnected between what we eat and what's in our microbiome. And also, I think it would be great to add probiotic foods to menu and handouts, especially in the clinical setting, knowing that they do have the potential to help our patients. My take-home message is that more research ultimately needs to be done to keep up with evolving research would also be important because as dietitians, it is in our scope of practice to know supplements and be able to explain them and recommend them to our patients. And recommend probiotic fortified foods and fermented foods would be great because obviously we saw that they do have the power to help. And these are my references. And then we can jump right into questions.
Great job, Rachel. Thank you for sharing that research. Probiotic fortified dairy foods. I think we already have a question in, and feel free to type yours as you come up with them. But Emily is wondering how much yogurt in cups was consumed at lunch and dinner for your second study.
Okay, so in the second study, I will go back to the slide quick and check that out. It was 600 milliliters per day, and so 300 was consumed at lunch and then 300 consumed at dinner. Milliliters.
You can also find the for an evaluation for Rachel in the chat box as well.
Thank you everyone for listening. I appreciate it.
And our final session will begin at 11:35, and everyone's going to join together to hear about intermittent fasting and metabolic syndrome. And the link is in the chat box as well. So if there aren't any questions, feel free to hop off of here, and then we'll join back at 11:35.